To confirm the diagnosis, the doctor continued, we'll need to run a few tests. He explained that a blood culture could identify the presence of Salmonella typhi, while stool and urine samples could also be tested for the bacteria. Once we confirm the diagnosis, he reassured the patient, treatment is usually straightforward. He explained that antibiotics are the most effective way to eliminate the bacteria and typically need to be taken for 7 to 14 days. It's crucial to finish the entire course of antibiotics, he emphasized, even if you start feeling better before completing the prescribed dosage. This, he explained, ensured the bacteria were completely eradicated and reduced the risk of antibiotic resistance. Prevention is always better than cure, the doctor stated, shifting the focus to preventive measures. Vaccination is one of the most effective ways to protect yourself from typhoid fever, especially if you're traveling to areas where the disease is more prevalent. He explained that there are 2 types of typhoid vaccines, an injectable vaccine that provides protection for up to 2 years, and an oral vaccine taken in capsule form that lasts for up to 5 years. It's best to get vaccinated at least 2 weeks before your trip, he advised, to allow your body enough time to build immunity. Besides vaccination, there are several other precautions you can take to prevent typhoid fever, the doctor continued, emphasizing the importance of personal hygiene. Always wash your hands thoroughly with soap and water before eating or preparing food, and after using the toilet, he instructed. If soap and water aren't available, use an alcohol-based hand sanitizer. Be cautious about the food and water you consume, especially in areas where hygiene standards might be questionable, he added. Stick to bottled water, avoid ice in drinks, and opt for thoroughly cooked food.
Remember, the doctor said, offering a reassuring smile. Typhoid fever is treatable, and with the right precautions, it's also preventable.
He could see the fear in the patient's eyes start to dissipate as she absorbed the information and realized that her condition, while serious, was manageable.
We'll run the necessary tests, he concluded, and get you started on the appropriate treatment right away. In the meantime, focus on resting and staying hydrated.
With a renewed sense of hope and a plan in place, the patient left the doctor's office, feeling empowered and ready to fight back against the invisible enemy within.